Buenas tardes. Mi nombre es Luis Borunda y tengo la oportunidad de hablar en inglés y español, pero hablo inglés un poquito más mejor. So I'll go ahead and make my remarks in English if that's okay. First of all, I bring you greetings on behalf of Governor Hogan and his administration and my secretary, John Smith, the Secretary of State. I have the pleasure and the honor of serving as the Deputy Secretary of State, serving the citizens of Maryland. Very honored to be here. Thank you for the invitation. And I hope that a couple of things I say will be of benefit. First of all, a little bit of background just to give you some historical context. I've been here in Baltimore for 30 years. And I'm originally from California. I was born in East LA. And when I was growing up, everybody looked like me. And so moving to Maryland was a little bit of a culture shock 30 years ago. Because if you've been here for that long, you know and understand exactly what I'm talking about. There weren't too many Latinos in the mainstream. And so consequently, as I started my business, I joined an African-American Chamber of Commerce, if you will, because at that time, there wasn't a Hispanic Chamber of Commerce. And so we ended up starting the Baltimore Hispanic Chamber of Commerce about 13 or 14 years ago now, but and there are some folks in this room that were a part of that original germination. I noticed Carlos Binadar over there. He was part of the group of Latinos that helped to push that along, as well as Eric Oribio. I think he's around. Oh, there he is. But as the commercial that will date you when I say these words will indicate we've come a long way, baby, and with a lot further to go. But it's been so fascinating to see the growth of the Latino community and how we've integrated into so many of our sectors. Whether it's manufacturing here in Maryland specifically, but also in Baltimore, whether it's the health fields, whether it's media, construction, politics, you name it, and you'll find a Latino there. And as I'm fond of saying to probably not anyone in this particular room, but there are places that I go and I say, have you noticed that the Latino community is growing? Oh, yes. Do you know that they're not going away? Oh, really? Yeah, they're not going away. And guess what? We're coming to a neighborhood near you. That comment has elicited some interesting stares and responses, let me tell you. But in terms of the diversity, and I'm just going to speak specifically to the Latino community because that's the community that I've invested so much of my life into here in Baltimore. The economic impact that Latino businesses have here in Maryland is astounding. Of course, many of you know that it's the fastest growing business community in the state of Maryland. And of that particular demographic, Latinas happen to be the fastest growing entrepreneurs here in the state. So thank you for that. I appreciate that. She's got a sign that says, 2 minutes, get off. No, she's giving me a little bit longer than that. So we have, we are definitely making an impact. There are some 40,000 Hispanic businesses in the state of Maryland. Again, covering every sector, everything from nuclear waste disposal to mom and pop sign shops like the one I own, to newspapers, to I mean, you name it. Again, that we're making inroads into these sectors. And so one of the interesting things about these small businesses in terms of the economic impact and how health affects them is that so many of us are one-man bands, or maybe we have 2 or 3 employees, right? And so what happens when the owner gets sick or one of his key employees gets sick? That can be a devastating impact on that small business. And you know, in fact, there are people that I know, business owners that I know, that they just can't afford it. They just can't. They're in there one way or the other. They're in there. I myself have been, you know, on ladders, you know, with the flu, hoping I don't fall, because I know that would have made a devastating, you know, economic impact on my family. And so that's something that we need to think about, you know, in terms of, you know, health and healthcare, is the small business owner and you know, what he or she does. As a small business owner, we were able to take advantage of the healthcare connection, and that's another interesting thing. As a business owner, we so many times are inundated with paperwork, and as all of us are, right? Forms and taxes and all of these, you know, things, and then all of a sudden, you know, we're inundated now with trying to. We literally spend hours sometimes on the phone with a healthcare exchange, and so that's something that we really need to also take a look at as well. Is how we can interact in a more streamlined and effective way with the healthcare system. But it is a real challenge in our community, which is one of the reasons why we need forums like this to talk about the importance of and resources for healthcare. And I was really excited to see on the program that the former Secretary of the Department of Health and Mental Hygiene was here to speak to you. And so when you have that caliber of a person, you know, speaking to us, that really is important. And it shows the growing importance of our community. And so I just, once again, just wanted to thank the organizers, and Monica, thank you so much for the invitation. And I don't have a whole lot more to say other than we just really need to pay attention to what's going on in our health system, and make sure that we're holding those that are part of our community, as well as those who are engaged with our community, accountable. So many times I think people are more interested in and I say this carefully, but many times people are interested in our community more for a dollar than our health or other aspects of our community. They understand that our economic impact in this country is nearly $1 trillion. And so, you know, whenever you have a market that size, it can be very easy for corporations to come into our community and really not how do I put this, not invest back into our community. And that's really, really critical. We need to make sure that the corporations that we're giving our hard-earned dollars to are in turn reinvesting in our community. So with those thoughts, I'll leave you, but we once again thank you for the opportunity just to come and share some of our thoughts with you. God bless. Does anybody have a burning desire? Yes.
No, I just want to ask you if you can speak a little about your USHI program.
Oh, yeah, absolutely. So in 2004, I'll take you back again to a little bit of history. I was appointed to the Baltimore County School Board. I was the first Latino to ever serve on that school board, I believe in 2002 or 2003, I forget the year. The significance of that from many perspectives is, I mean, in the historical context, the first Latino, but also I was able, utilizing that influence as a board member, to begin to try to understand where Latinos are at, specifically in the Baltimore County school system, but I began then to see that that the Latino community is at large in Maryland. There was an issue with our young people dropping out of high school, and so I went to then Governor Ehrlich and asked him to implement or create a position for a superintendent, for an assistant superintendent that would report directly to the superintendent of Maryland Public Schools to oversee Latino affairs, Latino student affairs. And the economic impact there was not feasible. But what he did do was create a grant. It was a $100,000 grant that we were able to get, and that lasted for 2 years, and then the next administration completely cut that out. But what we did with that was we began to meet with high school students, not just in Baltimore, but all over the state of Maryland. And that was created under the auspices of U.S. Hispanic Youth Entrepreneur Education. And we put entrepreneurship in there because, for me, that had been a way out and a way to begin to develop, some recognition. So, and plus entrepreneurship is really great for developing skill sets, soft skill sets that we all need. And that organization holds a Latino Black Student STEAM Summit. STEAM stands for Science, Technology, Engineering, Arts, and Math. And we do that. We've done that now for 3 years at Towson University. And we bring the Latino community, Latino high school students, together with the African American high school students. And there's about 40 to 50 students every year, every summer, that get together. Not always the same ones, obviously, but and they get together and they talk about some of the issues, and they're hard issues, and they're hard and heart, right? I wish that we could have expanded that, or that we could expand that, because as we now know, and we've known for a long time, there are serious issues in Baltimore City. So that kind of gives you a thumbnail of USHI. So thank you for asking that question. Are there any other questions? Yes.
So thank you for your partnership in the Centro SOL high school program that we've also
Yeah, that's a great partnership there, yeah.
But my question was, we've spent the day really talking about how we can increase access to care for Latinos in Baltimore City, but in the state.
Sure.
And wanted to get your thoughts on whether the Hogan administration would be supportive of some kind of program to guarantee access to care for all Latinos.
Yeah, I wish I could speak to that question directly, but I don't want to, and I plead ignorance on that in terms of our agency really does not have anything specifically to do with healthcare or healthcare delivery. But, you know, obviously that whole question, you know, it relates to providing both employers and employees a context to really be healthy, because without healthy employees and healthy businesses, you know, we suffer. And so I wish I could speak in not so general terms to you, but it's definitely something that we as a community need to take ownership again of. I got to tell you, and I'll just use myself as an example. You know, I'm overweight, and I need to take ownership of that, right? And so I think that those are some of the things that we can do as a community is talk about those issues, those, you know, that we have to take responsibility for. I know that didn't exactly answer your question, but thanks for the question. Yes, sir?
And second generation college students, but mostly first generation, you know?
Thank you.
And it really set a foundation for them, so I'm hoping that at a USHE, some of those students are going to become future doctors, and I'm sure some of them are on the way there already. Nurses, researchers. So thank you for the impact you made on our Latino youth here in the state of Maryland.
Thank you so much for that. Specifically, going back to the Centro SOL USHE partnership, there's a young man who has participated in both programs, Andres Cordova, who just graduated from high school 2 years ago, and that guy's a superstar. He's a rock star, and you know, he's from Costa Rica. I think he got here when he was in 9th or 10th grade. I mean, just, you know, hadn't been here for too long. 4.0 average. I mean, but see, we use him as an example, but there are thousands of Latinos right here in this state, just like that. There's a great program in Howard County called Conexiones. Kids with 4.65, I don't know how they get that, but, you know, they, you know, they're like way up there, you know, and I just wonder, what was I doing when I was in high school? But we really need to you know, continue to cast the light on those young people that can be and serve as peer mentors, and because obviously not everybody's there, but utilizing those resources, they can, you know, they can surely set a positive example for the rest of the community. Is that it? Thank you so much for that comment. Appreciate it.